Hello everyone, my name is Robert Johnson, student from Nightingale College. Today I will be performing a video where I am administering uh, two different types of insulin into one syringe. It's going to be 4 units of regular insulin, and I'm going to be using 8 units of NPH. First things first, get to the facility, wash my hands, compare. First of all, I am wearing my uniform and my scrubs, yes. So I'm going to be comparing the electronic health records to the doctor's orders, and from there, I'm checking to confirm the 6 rights. That's going to be the right patient, the right medication, the right route, the right dosage, the right time, and the right documentation. Everything looks good in there, and the order says that I'm to be giving. A combination of 4 units of regular insulin with 8 units of NPH intermediate insulin into one syringe. This will make it a total of 12 units of insulin to only give one subcutaneous injection or one subcutaneous shot to the patient. Now I would check and compare the electronic health records to the MAR, making sure that just as same thing with the doctor's orders to the electronic health records. Now, and that looked good, but now I'm checking the MAR against the electronic health records, and I confirm the 6 rights to both of those. And then from there, I'll wash my hands and get the medication out, compare the medication to the MAR, make sure the 6 rights is good there. And once the 6 rights is good, checking both insulins, I will go to the patient's room, introduce myself, knock on the door. Hello, Mr. Jones. My name is Robert, student from Nightingale College. I'm here to, there's a doctor's order for you to receive an administration of an injection for 2 different types of insulin. Before we begin, let me wash my hands and provide privacy. I'll provide the privacy, pull the curtain, then wash my hands, right? Okay, wash my hands. And then from there, I'll go ahead and check the patient's ID wristband. And Mr. Jones, can you tell me your name and your birthday? Okay, Raymond Jones, March 10th, 1954 is his full name and birthday. I'll thank the patient for that. And then I will explain to the patient that, I would ask the patient, do you have any allergies at all to any type of food, medication, or any type of seasonal allergy? Mr. Jones confirmed that he has no allergies at all. Right? And then from there, I would explain to Mr. Jones the information about the medication he's going to be receiving. Right? So the first one is going to be regular insulin. You're going to be receiving 2 types of insulin. I would explain to Mr. Jones he's receiving 2 different types of insulin combined into one syringe. And it's going to be 4 units of regular insulin that you're going to be receiving and 8 units of NPH, the intermediate insulin, combined to make 12 units of insulin into one injection. The action of the first one, okay, first of all, both insulins are prescribed by doctors usually to treat a person with type 1 or type 2 diabetes. The action of the first insulin is to draw glucose from your blood and into your cells to be used as energy later on to reduce your glucose levels. Let me think here. My brain just stopped on me. The action of this medication is to lower your blood sugar also, and to by stimulating the blood glucose uptake and skeletal muscles and fat, inhibiting the hepatic glucose production. Inhibiting the hepatic glucose production. This medication is used to lower and control the hypoglycemia of patients that has type 1 and type 2 diabetes. I think I repeated myself. The half-life use of this medication will provide Mr. Jones with it will provide Mr. Jones with the proper insulin that he needs 30 to 60 minutes before meals. Right, the contraindication of this medication, I will let Mr. Jones know that hypoglycemia is a contraindication. Allergies is a contraindication of this medication. Or if the patient experienced any type of allergic reaction or hypersensitivity to this insulin sometime in the past, right? One of the side effects could include tingling lips, let's see here, no, I'm sorry. Adverse reactions could include tingling lips, tachycardia, and seizures. Side effects of this one could be hypoglycemia, hypokalemia, and arrhythmia. And in some cases, maybe even skin irritations around the site where Mr. Jones may get the injection. The second medication, this is used to control hypoglycemia as well. I think I mentioned that, no, the half-life of this medication is going to be with Mr. Jones a lot longer throughout the day. This is an intermediate insulin, the NPH. So this one is to last a lot longer than the first one. The other one was more short-acting. Side effects of this one will include weight gain, sweating, water retention. Adverse reactions for the second ones will include confusion, weakness, headaches. If you have any of these problems with this medication, please let us know, Mr. Jones, because we don't want you to have any type of side effects, adverse reactions, or any discomfort from this, right? Let us know if you have any issues. Do you have any questions with this medication? No? Okay. So Mr. Jones confirmed he has no questions. So I'm going to go ahead and perform hand hygiene again with hand sanitizer I have here. And I'll let Mr. Jones know that, Mr. Jones, when you're getting this injection, you may feel like a little bite sensation that's almost like an insect bite. That's normal. That's that's what, feel like a little prick, like something's poking you. But yeah, that is very normal. So Mr. Jones is aware of that. Mr. Jones confirmed he didn't have any questions at the moment. Where would you like your injection to be? Okay, Mr. Jones confirmed he wants his injection to be on his belly. And just FYI, from this point on, I will make sure that when I'm drawing up the insulin, even drawing up the air to put into the syringe, I'll have a nurse there to verify, a fellow nurse, right? So what I'm going to do is I'm going to open up I'm going to take the tops off of these, of the insulin, and make sure they're not expired. I'm going to slightly rub them between my hands, right? Kind of warm them up, get them ready, and prep them, right? That one is slightly rubbed between the hands. Same thing with the other one. I'm going to rub them between my hands, right? Slightly roll it between my hands, right? Okay. Now from there, I'm going to use alcohol, one of each for each bottle, each bottle. I'll go ahead and wipe down the top. And let's see here if I can get this open. Okay. I'll wipe down this one here and discard the alcohol wipe. I'll wipe down the other bottle as well. Wipe down the top, let it air dry. Okay, so that one is going to air dry. And from there, I am going to, with the cap still on, I'm going to first draw up 8 units of air. With the cap still on, 8 units of air. There's 5, 6, 7, 8 units of air. Okay, making sure that is there. Yep, 8 units. Okay, I'll show it to my fellow nurse. 8 units of air. I show it to you guys. That's 8 units of air. And then from there, I'm going to take the top off. And this, I'm going to actually put into the NPH, right? NPH. The key here is I want to make sure that I do not touch the medication. I do not want to come in contact with the insulin, but I'm just injecting air in, right? The 8 units of air that's in there. Okay. Now, I will also draw up 4 units of air. 4 units of air. I'll show that to the nurse so she confirms. I'm going to show it to you guys. 4 units of air, right? And now I'm going to place the 4 units of air into the regular insulin. Okay. Inject the 4 units of air. Now this time I'm going to invert the bottle and withdraw 4 units of insulin from here. Slowly withdraw. Make sure that I'm on 4 units. Okay. Tap the syringe to make sure there's no bubbles. Right, if there's any bubbles, I'll tap the syringe. Right, everything looks good. I'll confirm with the fellow nurse that there is 4 units of insulin in there. Okay, now I'll confirm with you guys there's 4 units of insulin in that syringe as well. Okay, from there, I'll take the NPH and I'm going to also with the NPH. Okay, let's see here. Let me put this down on the table. And then with the NPH, I want to make sure that I'm not pressing down on the plunger. Now I'm going to invert the NPH. Now I'm going to be pulling out 8 units of the NPH, the intermediate one. 8 units. Just pull that down. Let me make sure I'm on my numbers. 8 units. Good. Okay. 8 units of NPH. Now I want to make sure that there's no bubbles in that one either. I'm going to tap. Right, but the key here, I will not be pushing on the plunger to put any medication back in this bottle. I'm going to pour that out, and I'm going to let the other fellow nurse see the syringe so that they can compare and check the doctor's order, or check the MAR, confirm that this is the amount. So just like for both of these, we let the fellow nurse see it, and we confirm with the doctor's orders. Everything looks good. Let me show you guys first, right? There's 8 units, right? Let's show you there, 8 units. And then from there, because I'm still in the patient's room and I want to check before I give, I want to do a one-hand scoop. One-hand scoop. Good. Just to recap for safety, one-hand scoop. And then from there, I will check the orders. Confirm everything looks good there. Then I'll give the injection. I'll clean up and I'll go document everything that just occurred. I'll document the injection that I just gave for the medication. That is 4 units of the regular insulin and 8 units of the NPH, total of 12 units of insulin. Thank you very much.